So it is with great pride and honor that that I introduce this next guest. There was a time not too long ago that I didn't think this day would come, and so I would like you to welcome not only the toughest woman that I've ever met in my life, but my daughter, Kayleen.
Thank you so much. I'm going to start off by just thanking Randy and Stuart for letting me speak today and give you a little brief history on me. I was born with a genetic disorder, the leading life-threatening genetic disorder for Caucasians in the United States. So I'm deemed by most people predestined to die and with a pre-existing condition. So I'm very hard to insure. We fought my whole life for coverage to keep me alive when people are more concerned with profit because they lose money on my case. And I'd also like to start off by one of the heads, made the comment, "You can't wait for me to get better so that you can stop being so nice to my dad." Sorry, Dad, I'm better. However, it would be appreciated if you were still nice to him. I would like to thank all the locals and individuals who donated to my fund, and thank you to all that had me in their thoughts and prayers. Now, will everyone please join me in taking 2 deep breaths? Now imagine yourself trying to take those same 2 deep breaths on oxygen and using all your energy. I do not have to imagine this. This was my life for the past several years. On February 17th, the ultimate gift was given. I received a double lung transplant. I spent 23 days in the hospital, and when it was time to come home to continue my recovery, that's when all the trouble started with the insurance company, saying I did not need some of the meds or the dose that the doctors were saying I needed to keep me alive. The battle went on for weeks to get me the drugs that I needed. I finally received them, but at a cost. 6 weeks after I was released from the hospital, I went to the doctors for a checkup. I had energy, I felt great, and I was eating good for the first time in years. I thought my health had finally turned around. But unfortunately, my lung function was down, my weight was down, and my blood work just was not right. I was immediately admitted to the hospital. For the next 10 days, my dad and I sat in a hospital room with no answers. During this time, I underwent several tests and procedures. The answer finally came. I had cancer. The doctors explained everything and the treatment options. After the doctors left, we just sat there in silence. Then I turned to my dad and said with a bit of a chuckle, "Hell, I got cancer." We both started to laugh for a while. And I turned to him, again with a much more serious tone to my voice. What was I going to do? Then he looked at me, and with great confidence in his voice, he simply said, "We kick its ass too." I come from a long line of people who don't mind kicking ass when it is necessary. When a job needs done, we stand up and get it done. I had only a 2% chance of getting this cancer. I learned that if I would have been able to get my meds and at the right dose, there is a high probability that I would not have cancer today. I was livid at this. If the insurance company would have only listened to the doctors and I was able to receive the meds that I needed, it wouldn't have happened. Then, just when I started to recover a bit from the cancer, I was thinking to myself, what else could go wrong? But something did. 6 weeks after learning I had cancer, I went to the emergency room with the worst stomachache you can imagine. I had an intestinal blockage caused by my chemo. It required surgery to remove a portion of my intestines and another 15 days in the hospital. Today, I have spent over $1 million since February in healthcare. I reside in West Virginia for the time being. They have switched the Medicaid program over to the private sector, which is saving the state tons of money. But at what cost? Everything is denied the first time. Everything has to be pre-approved. Getting pre-approval is this big hassle, communicating back and forth 10 or more times before it is approved. It often takes weeks to get tests done that could save my life. People say they do not want the government between them and their doctors, but I ask you this, who is between you and your doctor now? Would you rather have someone that is concerned with profit or someone that is concerned with service? We cannot allow this debate to change in the country. Every man, woman, and child desires and deserves the right to reliable, affordable health care. We must hold accountable those individuals that we sent to Washington to represent our interests. We must be willing to punish those who don't. And we all know how to punish a politician. We send them home and make them irrelevant. So in closing, I urge you to come together in solidarity and make one more phone call, write one more letter, attend one more meeting, and have one more conversation. And if it requires us to kick some ass along the way, I promise you I will be the first one on the bus and ready to ride. Thank you.